In a previous Chairside Live episode, I detailed a posterior BioTemp treatment on adjacent molars that turned out very successful. Today, I'd like to show you another BioTemp treatment and one of my favorite procedures to perform in dentistry as an RDA, anterior multi-unit temporaries with BioTemps. So to start this process, I can either send a set of pre-treatment study models or impressions with bite registration and a shade to the laboratory on a dedicated Glidewell BioTemps Provisionals RX form for fabrication. Expect a 5 to 6 day turnaround time and schedule your patient's prep date accordingly. Well, now that my patient is in the chair and my BioTemps have arrived, let's go chairside and see them in action. So expect your BioTemps to arrive packaged similarly to any crown or bridge case that you will receive from Glidewell. Your BioTemps will come as one splinted unit unless you specify otherwise. The lab can even include metal framework for long-span bridges or high-impact areas at your request. These BioTemps for teeth 7, 8, and 9 have been fabricated from virtually prepped models and seat well upon try-in with no rocking and minimal reline necessary. I cannot begin to stress the importance of applying Vaseline to freshly prepared teeth before relining. The last thing I want to do is have to cut through my beautiful BioTemps because I fused a reline to the preps. When applying Luxitemp acrylic reline material to the integlia of my BioTemps, I extrude a minimal amount and use the mix tip to coat the inner walls with the material and evacuate any air bubbles or any voids that may have gotten trapped. Using a dry microbrush, I remove some of the bulk excess material that may get stuck between the embrasures. I take great care in removing BioTemps, or any temporary for that matter, with rubber-tipped crown removers to prevent scratching the facial and marring my aesthetics. As you can see, my reline looks good with no voids or delamination from the BioTemps. Moving over to my lab bench, I start with the removal of the bulk excess acrylic reline with a coarse diamond burr. I always use a good hand fulcrum for control over my handpiece and short swiping motions to avoid nicks or cuts. I like the fact that most of the work is already done for me. I don't need to touch the facial or incisal of these restorations at all. This is one of the major benefits for BioTemps versus a standard chairside temporary. Now that I have smoothed and removed the acrylic flash, I'm going to get into details with a lab diamond disc. Get really comfortable with a good fulcrum hand base and don't be nervous to get into those embrasures to open them up and allow the tissue adequate healing room. Even more details can be carved out utilizing a mosquito diamond burr in the same manner as my initial diamond takedown burr. Smooth everything up and let's try our BioTemp back into the mouth. If I have opened my embrasures enough and my margins are spot on, I should have no trouble placing my BioTemps and checking for space with a perio probe or a similar instrument. I have cleaned all excess Vaseline, saliva, and contaminants for my preparations. I apply temporary cement, in this case Temposem non-eugenol, in the same coating pattern as my initial reline and place it in the mouth in a rocking motion to allow excess material and air to evacuate and seat completely. The patient can bite into place to assist seating, but I like to hold the restoration in place during the curing time with a cotton roll as a cushion for my own fingers. Excess temporary cement should remove easily with an Explorer and an air water rinse. My patient is still a bit numb while smiling after placement, but this is a great thing. Our process from final impression to dismissal took 15 minutes total. Plus, I got the result that we were both trying to achieve. So, why BioTemps? I've already shown their aesthetic qualities and ease of application, but I also take into consideration the price point. Taking less time chairside is simply a line item shift that makes BioTemps an affordable addition to your procedures. Our BioTemps Classic utilize denture teeth set into position, while BioTemps CAD are designed and milled custom for every patient. I enjoy the different options they give me and the versatility of the material while decreasing the time I have to worry about aesthetics. Let's be realistic. Our patient's main goal is to look good, while ours is to provide exceptional dental treatment throughout. If we can merge these two goals, that is a recipe for success.